Hello, this is Jan Hively. Mary Radu and I are co-leaders for the ALPA curriculum. We've been developing this now for, it seems like forever. It's just about 2 years, over the last 2 years, and we certainly hope that we have a package that you will appreciate and from which you will learn and change your expectations for aging, which is the topic for this presentation today. I want to tell the story, my own story, about how my own expectations for aging have changed as the example for you as we talk about this issue. My background is as an educator and planner. I had been in city planning with the city of Minneapolis in Minnesota. And then I was on the faculty of the University of Minnesota in 1998 when the story begins. I was getting close to retirement. I was working around the state, supported by the College of Education and Human Development, the Department of Education at the state of Minnesota, and the Agricultural Extension Service to bring schools and communities together in rural areas, particularly around the state, to do classroom learning, service learning, and workplace learning, encouraging both life work planning on the part of every student and also preparation for the workforce, for school to work, they called it. Life work was following the theme of building on strengths and interests really from the beginning of elementary school right all the way through. In the fall of in the fall of 1998, I attended a conference, and the head of the Association of Minnesota Counties stated at the beginning of her speech, "Aging is our biggest problem." Well, I was taken aback by it because personally I think it's a lot better than the alternative of not aging. But I also understood for the first time the terrific demographic change that was occurring in that state, from which young people had been leaving the rural areas for generations. The changing in farm practice, and the older adults were becoming more and more predominant, often over 50% of the population in communities. So I could understand the perspective of this person who was a public official and along with other service providers was focused on meeting the health and social service needs of older adults with disabilities. The costs were getting higher and higher while the budgets were getting trimmed. They were seeing old people as dependent recipients, as a burden on society, and they were fearful about the intolerable costs of an aging society. Their expectations were focused on the negative. And that's the tradition when people have thought about aging. They've tended to focus on decline, on health and disabilities that occur, chronic illness. Our expectations for ourselves have been shaped and often limited by those of others, by those traditional expectations. We tend to conform or live up to others' expectations, or perhaps down to them in this case, to the expectations that we grew up with. Now I'm 80 years old. My expectations in 1998 when I heard her statement at age 66 was, well, maybe I'll live to 80. I really didn't expect to live much longer than that. I didn't really realize, I hadn't thought much about longevity. My mother, who was born in 1900, was born in an era when the average age of longevity was 53. I was born in 1932 when it was 63. My daughter was born in 1960 when it was 73, and my granddaughter in 1993 uh, was in an era when the average age of longevity was 78. So imagine that in that period of time, thanks to lots of medical miracles and good nutrition, the average length of our life had gone over 150% of what it had been in 1900. And now, as of the 2010 census, women can expect to live up till age 83. Now, my response in 1998, when I heard her say that aging was the biggest problem, was to think, as a researcher, well, let's hear what the older adults might say about it. I knew what I would say. I would say that this was a good time of life and I was healthy and active. I decided, since I was on preparing to do my dissertation for my PhD at that time, to focus my PhD dissertation on productive aging, positive aging, to hear those older adult perspectives. We set up seniors lead forums in 4 counties and asked the question of several focus groups, and then brought it to 2 large conferences. What's most important for you as you grow older? The first, absolutely most important thing is self-determination. Pretty much all older adults say, I want to make choices for myself as long as I possibly can do so. I also want to be self-sufficient. That means that I want to be dependent upon myself and not others, as long as I can do so. I want to participate in community. I want to have access. I want to be acknowledged for my participation when I contribute to community. That can be work or volunteering, whatever. And it's important to combat ageism, because I feel from others the sense that they think less of me than I think of myself. So seniors spoke and the staff listened, and that led to my next step, which was to prepare the year 2000 Productive Aging Survey. I hired senior companions to interview 55 to 84-year-olds in 4 rural counties. They did a sample that could be seen to replicate the total. We very carefully selected over 200 interviews were accomplished, in-depth interviews. So what we were doing was looking at productivity based upon the hours spent in employment, in volunteering, in caring for children, grandchildren, or for the sick, caring for the sick and disabled. That's because in my work with life-work planning with youth, I had understood that work is simply productivity that benefits you or your family or community or your employer, but that the skills, habits, and attitudes that comprise productivity, that support productivity, are the same whether you're parenting or learning or volunteering or working in the workplace. That I believe that productivity in the part of older adults, whether it was paid or not paid, was beneficial to the community. It was important for people to see the value that they could contribute and that they were already contributing. So we set up a end result of assessing the community value as dollar value of sharing strengths, multiplying the number of hours that people reported times minimum wage. First of all, we found that people said they were feeling good. They were healthy and active. 76% of the 55 to 84-year-olds reported themselves in good or excellent health. And by the way, that to me shocking, because it was so much greater a percentage than I expected. It was the same nationally, I found later. So isn't that amazing? Over 3/4 of the people up into their 80s report themselves in good or excellent health, healthy and active. 92% said they were very emotionally satisfied with life. 90% felt that they were in charge of their lives. And by the way, when it came to being dependent on others, it was only 2% who were taking financial aid from their children. The rest were giving their financial aid to their children. I noted here that 90% of the people surveyed were active churchgoers. I report that just because that tends to be the place through which most of the volunteering is done. About this same time, at the beginning of about 2002 or 2003, the National Council on Aging reported that 71% of 75 to 89-year-olds say, "These are the best years of my life." Or they say, "Living another 10 years would make me very happy." Again, about 3/4 of people. Count me in on that. That the best years of my life have been since the year 2000. Since I turned 68. Another big important result from the productive aging survey was that they were doing what's needed. They reported that they were caring for themselves and others, 40% working, 61% volunteering. Imagine that, very high. And that's volunteering through an organization, not just simply doing something good for somebody on one day. 46% helped care for grandkids, many of them 40 hours a week, while their children were going off to second jobs in towns located far distant from their rural communities. 39% were providing care for sick and disabled, and not just family members, not just spouses, but for neighbors as well. So these were people who were contributing substantial value to the local economy, and they were eager to do more if barriers were overcome, for example, the lack of transportation on the part of some. So my point here is that we cannot afford to be aged by traditional expectations, by our culture. We need to change the culture. And we can gain lessons from the blue zones, the areas which 5 years ago were identified with having the highest percentage of people over the age of 100. A guy named Dan Buettner went and put together a study group that did research in those 6 highest zones. What mattered the most in those areas as far as the health was concerned? Nutrition. They tended to eat a lot of fish. Exercise. Most of them were mountainous, hilly, so that people had to climb and keep climbing if they wanted to do anything, go away from their homes, up and down the hills. Relationships. Most had lived in the same place all their lives and had established friendships, friends that they saw every day and with whom they shared much. They did not retire in these communities. They had purposeful roles right up through the last breath, whether it was caring for children or for animals or planting, caring for the house. It was purposeful role, and that was a big part of their living. They knew that they had to live to get the job done. So I, after completing that survey, realized with my own changed expectations that it was important to encourage advocacy leadership for vital aging, particularly to get older adults themselves involved, so that they would raise the awareness of others like themselves to see all the opportunities that are offered in later life, to identify their own strengths and interests and needs and those of their community, and to make progress in expanding their doing what they want to do, and expanding the health of the community, the capacity of the community to support what they want to do. Remember, community participation and access. And to try things out to evaluate progress. The Vital Aging Network is still growing and very healthy. Now, 2 years later, Vital Aging Network started the Advocacy Leadership for Vital Aging curriculum, now called Evolve. It's offered with community colleges throughout the country. And here we are in 2013 with our Advocacy Leadership for Positive Aging, ALPA program. The purpose for you is to identify and share strengths for yourself and those who you work with. So this is a chart that shows the way that the curriculum flows. I think you've perhaps already looked at this and the sequence of our classes. But what we want to be sure of is that you understand the changing expectations for older adults, the opportunities that are offered, and also the challenges, particularly offered by today's economy and exacerbated by the dramatic growth of older adults with the boomers coming along. That you have the tools to assess your own strengths and needs and work with your clients on that process, to set your goals and find resources to do some field work to try out these concepts and to take action. So that's my spiel. It's a big goal for us all to make sure that our expectations match with reality, the reality that older adults perceive, and to help others, particularly those who have grown up with ageist expectations, to change and improve their expectations for positive aging. It's time now to introduce Peter Whitehouse. I'm thrilled that he is participating with us. He has been part of the group who have wanted to develop this curriculum since we first met in January of 2011. He will show us how 21st century research developed just since the year 2000 is raising our awareness and expectations, and how it's so important to integrate body and mind as we change to a focus on wellness. Thanks for listening to me, and please devote your attention to Peter, who has an outstanding PowerPoint presentation for you.